Starting in 3, 2, 1. Welcome to our video, The 5-Part Lens, How to View Training Through Existing Constructs. We're going to be going over 5 modern constructs in regards to physical training, and we're going to be putting them together in the next video as part of the method that we're discussing, the human movement method and this evolutionary biomechanics. So first, we're going to look at the traditional model of movement. The traditional model of movement originated in the 16th century, Europe, during the Renaissance. It was put on by a gentleman by the name of Vesalius, and his exploits are documented in the legendary anatomical text De Humani Corpus Fabrica, which I don't know this to be certain, but I'm willing to bet that translates to the human corporeal fabric. There were a few errors in this model. The human jawbone is formed from a single part, not two. Women do not have one more pair of ribs than men do. And the human breastbone does not have 7 parts, it has 3 parts. During the Renaissance, the study of comparative anatomy began and ushered in a new understanding of how humans and other animals functioned in this world and what their differences were. During this period of time, they talked about transitional anatomy, mainly levers. So this actually goes all the way back to the 16th century, the identification of leverage. During the Renaissance, they understood physics and geometry, and this was applied to human anatomy. First-class levers. If you've done a personal training certification, this is like one of the first things you learn, but first-class levers, having a fulcrum between the force and the load, like a seesaw. This is expressed by, for example, there it's looking at, I don't know if you can see, but they're talking about where the skull pivots on top of the spine. Second-class lever, having the fulcrum at the end of the lever and the force at the other end and the load in the middle. This is like a wheelbarrow. So you have to understand, in a wheelbarrow, the fulcrum's at the end and the resistance is in the center. So in this case, this is similar to how the ankle works. And then lastly, we have a third-class lever. This is having the fulcrum at one end and the load at the other, and the resistance is at the far end. And the force in the center, like a broom. So when it says like a broom, what this means is basically the whisks of the broom are at the end, and you're trying to apply force at that end. And the fulcrum's at the top, and then you apply the energy in the middle. That's one way to use a broom. The other way you could use a broom is actually like a first-class lever, but irrelevant. So in this case, that's like the bicep. So after a while, we updated and came up with new models that have been more effective, for example, in treating pain. One of them is known as the regional independence model. So before I click any of these bullet points, I want you to see here on the right-hand side, you can see that what you have moving through the body, and this is true 80 to 90% of the time, is that you have this alternating stable, mobile, stable, mobile, stable, mobile orientation. You see it in the spine, you see it in joints, and what this does is it allows the human body to create rotation. We generate linear force through rotation, and we generate that rotation through this interdependent model of stability, mobility, stability, mobility, stability, mobility. The regional independence is the concept that seemingly unrelated impairments in a remote anatomical region may contribute to or be associated with the patient's primary complaint. Current research has shown that the regional interdependence can be affected not only by other regions in the musculoskeletal system, but impairments from varying body systems or regions. So to put that into English, an example of this would be, perhaps you've heard of it, is like how, for example, if I have knee pain, that could be coming from my ankle or my hip. But it is, so we can treat the knee itself, but we also have to look above and below that to see what other structures are affecting it. So if you look here, you see that these are three-dimensional axes at different points in the body. So if this three-dimensional axis is off, then this axis will be off, then that axis will be off, and this creates issues. We're going to talk about this further down the road in this presentation, but kind of remember this because this is a really good example of how curvature in the spine is part of an interdependent model, for example. So we already talked about this, alternating stable and mobile joints. It is important to understand that this is a three-dimensional model and not a two-dimensional one. So often when we look at human anatomy, we see it in a two-dimensional way, but the fact is human anatomy is not two-dimensional, it is three-dimensional. Muscles, for example, really are not linear. Most of the time they are wrapping around bones. They're moving through three-dimensional space. Very rarely do they move in straight lines. When the body is balanced and controlled properly, the goal is to limit shearing force and compression on joints. We've talked a little bit about this before. And so shearing and compression are the enemy of like organic systems in general. So the less compression and the less shearing force we create, the longer the joints and the ligaments and the tendons and the bones and the muscles and everything else are going to work better together long term. This can be used to help with issues and create better mechanics for performance. So understanding the regional independence model will allow you to, either in your own training or for your clients, visually be able to assess where things are not moving properly and then make plans accordingly to address those areas, and not just the specific area, but the areas above and below, because what you may have is a complex system that's interacting. And you really have to take into account all those factors. So next we're going to look at the 3D plane-based model of movement. So if interdependence is a thing, well, so does moving through three-dimensional space as a body. In theory, every exercise performed in the gym can be related back to movements that we all do in real life. So this is in theory. I would say there's a correlation, but I would not say that there is a direct line. And I'm going to talk more about that later. So the argument here says that we all push, pull, flex, extend, squat, lunge, bend, and twist throughout the day, every day. I'm going to debate this later, but we'll talk more about that. Most traditional exercises are performed in one plane more than the others. And this is kind of where the theory breaks down for me, is that in real life, in a dynamic environment, in an evolutionary environment, in a survival environment, that's not going to happen. You're going to be dynamically moving through space. In a very complex and organic way. So I don't personally agree that a bench press, a pull-up, a deadlift, a squat, I don't think that those things actually translate to dynamic human movement. I think they correlate with dynamic human movement. So first we're going to look at the sagittal plane. It cuts the body into left and right halves. And forward and backward movements. Then you have the coronal or frontal plane. It cuts the body into front and back halves and handles side to side or lateral and medial movement. And then you have the transverse plane, which cuts the body from top to bottom and also allows for like twisting movements. So next we're going to look at the Yanda approach, treating neuromuscular imbalances. So Vladimir Yanda was, I believe he was Czech, and he was stricken with polio at a very early age. There's a great book called The Assessment and Treatment of Muscular Imbalance. The Yanda approach blends postural techniques, neurology, and functional capabilities in order to alleviate chronic muscular skeletal pain and promote greater functionality. He identified something known as tonic and phasic muscle systems, which we're going to talk more about. He identified upper cross syndrome, lower cross syndrome, layered syndrome, and muscle control is a neuroadaptive process first. So, when we talked about how the nervous system is the very first thing to function when it comes to stimulating adaptation in a human body, when we were talking about the principles of modern training, this approach, the Yanda approach, roots that in place. Muscle adaptation occurs as a result of repetitive action. Those repetitive actions require neurological signals first. So it's really important that we're training the nervous system as well as the musculoskeletal system. And, these pathologies are part of the natural relationship between the tonic and phasic systems and can be made worse by lifestyle stress, trauma, or overuse. And what we're referring to here is upper cross, lower cross, and layered syndromes. So the reason that this becomes important is because when we have chronic musculoskeletal issues, what happens is we have this thing called the loci of movement and the injury cycle. And this is where people tend to kind of break down over time. And what I mean by that is that they encounter something that causes discomfort, then they avoid that thing. So let's take a look here. So dynamic movement, running, walking, sprinting, throwing, climbing, crawling, labor, lifting, digging, raking, sports, play, and overall fitness. This is what we all aspire to, and when we're children, we have access to all of this, or at least most of us have access to all of this. As we age, this diminishes, and we're going to talk about why. Say you get an injury, or you just get older and you're not exercising properly or taking care of your body, you have less dynamic movement. No longer can you sprint without pain, so you reduce your capacity to walking and jogging. You get older, you get heavier, maybe you find that, you've put on some weight, or you've been doing an activity that puts a lot of compression on your joints. So you reduce the capacity for climbing and crawling, but, you keep swimming. Swimming is very low impact, and lots of people do it well into old age. There is a reduced capacity for labor at this point, and sports and play and fitness suffer. You still can go play things, but maybe you trade up tennis for pickleball. Maybe, you stop walking with your golf bag and you start taking the cart. Maybe you hire somebody to mow your lawn, that kind of thing. So now we've got basic movement. You get injured again, you've been, avoiding certain movements. And so now you're down to sitting, standing, and walking. That's the only thing that's comfortable. You can toss underhanded, but you can't really generate explosive movement. You have a limited capacity for labor because you find that your ankles, knees, hips, back, shoulders hurt. And so therefore you also have, limited capacity for play. And then, over time, you continue to avoid things as little things come up. And now you're down to being essentially impaired. You have chronic pain, you have reduced movement, you have reduced play, and you have a significant loss of quality of life. And this is what happens as a result of what's known as the cumulative injury cycle. So let's take a second and go back to the Yanda system and talk about tonic muscle systems. So you can see here on the image on the right, tonic systems are essentially postural. phasic systems are for large, gross motor movement, the things that we can consciously control. Tonic systems are not really under our conscious control necessarily. They're under our influence, but maybe not under our control. And the other thing that's interesting is although these muscles may be smaller, they are incredibly nerve rich, and we'll talk about that. So the tonic systems, they are phylogenetically older, which means these tonic systems actually develop in utero. And a really simple way of thinking about them is they are the muscles that hold you in the fetal position. Generally, they are flexor-based or postural. So if the muscle is capable of flexion, it is likely tonic. There's a tendency with tonic systems towards tightness, and that's because they provide stability. They are readily activated in movement, especially when fatigued. They are part of novel or complex movements because, again, they hold posture together. They are less likely to atrophy over time. And so if you're living a very sedentary life, these muscles, relative to the phasic systems, can actually wind up getting stronger. Not meaning that you get stronger, they get stronger relative to the phasic system. It's an important distinction. Typically applies to single joint muscles. This means a muscle that crosses a single joint. And they are stress and trauma activated. So if you are in a traumatized state or you're in a chronic stress state, these muscles will inherently and naturally tighten. Again, because your body's trying to pull you into the fetal position on some deep, survival level. And we inhibit that as modern humans, but your body wants to do it anyway. And as I mentioned, they are often very nerve rich. And the reason for this is because they send a lot of afferent information into the nervous system to help with something known as like your balance systems, proprioception. All right, so now we're going to list off all the muscles that go into this. So in the upper quarter, we have the suboccipitals, we have the pec minor, upper traps, the upper fibers of the traps. So this is interesting. You will also notice that with tonic and phasic systems, even though the trapezius system is, a big chunk of muscle, they make a distinction between the upper, middle, and lower traps. So the upper traps are considered tonic. The levator scapula, the the SMC, actually that's just spelled wrong. It should be the sternocleidomastoid. So the latissimus dorsi can operate as a tonic system. The forearm flexors, deltoids, masticators, those are your jaw muscles. And lower quarter, we're looking at the quadratus lumborum, what most people call their lower back. The thoracic paraspinals, which are a really interesting set of muscles that run up and down your spine. The rectus femoris, which is your primary knee flexor. The piriformis, which is underneath your glutes. The iliopsoas. The tensor fasciolata, or TFL, which controls the hamstring. Not the hamstring, which controls the IT band. The hamstrings. Adductors, which are your inner thighs. And the tibialis posterior, which is a deep muscle that people often mistake for their Achilles tendon. Now we're going to look at phasic muscle systems. They are phylogenetically younger, which means you actually develop them after you're born. You develop them when you start crawling around on the ground and when you have tummy time. They generally tend to be extensors. They have a tendency towards weakness, hypotonia, and lengthening. That's particularly true for people that have tissue disorders. They have delayed activation in movement, so they activate slower than the tonic systems. They are more likely to atrophy, so if you're completely sedentary, they will atrophy first. It's also because they're physically just more of the muscle. They're more fragile. They're more likely to tear or break down. Typically applies to double joint muscles. So they typically will span over multiple joints. That's not always true, but it's typically true. They are stress and trauma inhibited, meaning if you are really stressed out, chronically or you're in a traumatic state, they can become weakened. They are often less nerve-rich, also because they're on the surface, because if they take damage, this is actually a protective mechanism that they're less nerve-rich because they're more likely to be damaged than the tonic systems. So it's better to have less nerves in them. So the middle and upper traps are considered phasic in certain capacities. The rhomboids, the serratus anterior, deep cranial flexors, upper extremity and extensors of the supinators. That's the rotational muscles in your arm. By the way, I think that middle and upper traps is supposed to say middle and lower traps. I don't know why that typo's there, so please forgive that. The digastricus. And then in the lower quarter, we have rectus abdominis. I don't know why they call it a quarter. And the rectus abdominis obviously is not part of your legs. So the transverse abdominis, this is your core. Your glute max, median, and minimus. The vastus lateralis, which is fascinating series of muscles. The vastus medialis, these are the outer heads of your quadricep. The tibialis anterior, that's the muscle on the front of your shin. The perineals, which are part of the pelvic floor. So what about the obliques and the scalenes? They actually came up in the system twice. They can be tonic or phasic, which is really interesting. The obliques and scalenes can be considered both. They're in both categories because they are breathing assistance muscles and they work in synergy with the body to maintain breath in motion. When dysfunctional, they can join either system. It's also important to note that they're a big part of lateral stability and rotation. The scalenes and obliques both, they kind of mimic each other because the obliques help manage the rotation of the thoracic spine and pelvis when walking. The scalenes in the neck also help decouple that movement from your head so your head isn't jostling around while you walk. So let's take a look at upper crossed syndrome. What does this mean? Well, as you can see here, if a person has forward rounded shoulders and a forward head posture, what we are modernly calling like tech neck or desk posture, this means that they have tight pecs, a tight SCM, they have tight upper traps, and they have a tight levator scapula, which means we need to release and stretch these areas. We're going to talk more about what that means later. And now, so by releasing and stretching those, we're going to loosen those, and we want to strengthen or activate the deep neck flexors, the rhomboids, the middle and lower traps, and the serratus anterior. This is going to help to roll the shoulders back and change the orientation of not only the shoulders, because you have to understand that the shoulder is really just attached to the scapula. We also need to be adjusting the position of the thoracic spine and of the head and neck. Now let's look at lower cross syndrome. The tight muscles in this particular case are the lumbar erectors and the hip flexors, rectus femoris and iliopsoas. We need to release and stretch those as much as we can. Now, when we talk about releasing and stretching the iliopsoas, we're going to get into that probably later, but it does not respond the way other muscles do. So we'll get into that later. You'll also notice that the stuff that we are looking at here tends to also be kind of more toward the tonic systems. These are the tighter, locked short muscles tend to be tonic, and the weaker, locked long muscles tend to be phasic. So now we're looking at, we need to activate the glutes, all of them, the maximus, medius, and minimus, and the abdominals. And this includes the TVA. This is really important. The transverse abdominis is absolutely vital to spinal stability. And you have to understand that the TVA in most Westerners they don't know how to activate it, and it's not under control. It's not under conscious control. And since it's not under conscious control, it may not very well be under effective unconscious control. So making sure if your clients or yourself has lower cross syndrome, you really need to learn how to effectively engage your TVA. Now we're going to look at layered syndrome. Now in Yanda's work, he says that recovery from layered syndrome is not, he says it's not fully possible. I don't know that that's necessarily true. So you can see here that the reason it's called layered syndrome is because if we look at back to the interdependent model, and we were talking about that stable, mobile, stable, mobile, stable, mobile situation, what you're seeing here is that the weak muscles tend to be around the stable areas, and the tight muscles tend to be around the more mobile areas. And it's because they're trying very, very hard to stabilize the skeleton and the muscle systems in a really inefficient way. So often seen in older adults, layered syndrome is a combination of upper cross and lower cross syndromes. The layered syndrome is characterized by tight hamstrings, tight trunk extensors, tight pectorals, and tight upper back and neck muscles, coupled with weak mid-back abdominals and hip extensor muscles. So to put this really simply, you want to loosen the dark parts and you want to strengthen the light parts. So, or activate. You'll notice that I continuously use activate and strengthen interchangeably. Because a lot of the time people think that means just strength training, when in reality you can activate a series of muscles in a lot of different ways. So the next lens we're going to be looking at after the Yanda approach is the myofascial sling-based theory of movement. This comes from Thomas Myers in the book Anatomy Trains. This is really high-level stuff, and we're going to spend a lot of time on it today. Like I said, created by Thomas Myers. Explains the interconnected nature of the tissue in the body, is the result of years of research and hundreds of dissections, gives us a clear view of how not only muscles, but also connective tissue, specifically collagen and fascia, affect the interdependent model, explains how the body utilizes fascia as a flywheel to save energy and motion, or to store energy to be transferred through the body in powerful motions. It's also vital for structural stability and shock absorption. It gives us a model for how kinetic energy is transferred through the body, again, shock absorption and stability, and can help us assess and correct postural and movement-based issues. So being familiar with this is going to be absolutely massive when you are watching a person move or reviewing videos of yourself moving and you see discrepancies and you want to make, we'll say, both sides of your body more similar, or you want to correct posture. Basically, everything we've already talked about up to this point can now be seen through the myofascial meridian lens. So what is fascia? So fascia is this really interesting tissue in the body, and it's pretty much everything. It's all over the place, but it's primarily made of collagen, and it is a fluid regulator. It is elastic, and apparently it's what is it? Is it a solid? Is it a liquid? Apparently it is a chrysolite gel, and it can actually transmute its properties based on how much fluid it absorbs. So what that means is it can practically act like a lubricant and glide and slide and be elastic and extremely springy, or it can be remarkably rigid and really, really strong. You will sooner break bone than you will break down fascia. In the early days, as we were learning about fascia, people would talk about breaking down the fascia. You do not break down fascia. You transmute its properties by hydrating it. And then over time, through certain consistent stimuli, it may remodel itself, but trust me, you're not breaking it down. You will, like, rolling your IT band, for example, you will sooner break your leg than you will change the structure of your IT band with a foam roller. It is the dark matter of the body. For a long time, they thought it was an inert tissue that did absolutely nothing, and it turns out it pretty much holds us together. It is everywhere. Believe it or not, if you dissolve the calcium salts out of a bone, what you're left with is a strip of fascia. It's a fluid regulator. It controls. Without fascia, we could put you in a bucket. You would literally just be a puddle on the ground. Basically, there's a cell. The fascia creates a matrix for the cells to fit into and hold their structure. It's a shock absorber, as I've mentioned. It's a sensory organ. It has 7 to 10 times more nerve endings in it than muscle does. It is quite possibly the largest proprioceptive organ in the body. It may very well be the largest organ in the body. And what I mean by proprioceptive is you have to think of the fascial network in the body as like a spider web. When a spider sits on a web, if a fly hits the web, the spider knows where the fly is on the web because it can sense it through the web. Your fascia is essentially that spider web. Everything your body is doing, your body knows where it is relative to itself through proprioception. And that proprioception is heavily fed by fascia. It provides stability, structural stability. Believe it or not, your bones don't hold you up. Your fascia does. It can be solid like a tendon or ligament. It can be gel-like. It can be filled, we just talked about that. It can be filled with calcium salts and turned into bone. It is ever present and functions as a scaffolding even for the brain's neurons. So it's all fascia. It's all fascia. Every part of you is fascia. Fascia is present at every layer of muscle, from the bundling of cells into fibers, fibers into bundles, bundles into muscles, bundles into muscle heads, and then muscle heads into muscular units, and those units ultimately link together into myofascial slings. This is an example of that. You can see here how the cells are packed into the fibers into the bundles, and so on. Now, what's interesting about this is that fascia organizes itself in certain ways. On the left, what you see is a lattice structure. And that lattice structure is really, really important because that's what healthy fascia looks like. It absorbs shock well, it recycles energy inside the body well, and it protects you well. If you're sedentary or there's been injury or even scar tissue, it looks more like a Brillo pad on the right. And this causes a reduction in range of motion, a reduction in shock absorption, and it makes movement more challenging and less efficient. So let's take a look at the slings themselves. What you see here is an example of the myofascial slings. So first, let's look at the anterior and posterior superficial lines. These lines kind of act like the mast of a boat. You can see kind of in this little picture here at the bottom, on the left, on the left sail is kind of like the posterior, and on the front sail is kind of like the anterior, and then the mast in the middle, the big pole that runs up and down, that's basically your skeleton. So these are vital to posture. They work together to allow for standing. If you literally cut one of these lines or removed it, the body would bend over in the other direction because it would have no counter force. The dynamic tension holds up both sides. In Westerners, we tend to be anterior dominant, which causes posture and pain issues, which is what we're right now referring to as either upper cross and lower cross and layered syndrome, or what a lot of people are talking about as tech neck or desk posture. There are 3 layers to the myofascial system that are important to note. And that's the superficial layer, which is just under the skin. It's extremely flexible. It's very pliable. It's packed with nerves, blood vessels, and the lymph system. It provides a degree of cushioning and buffering to protect the body. And then there's a deeper layer, which is like the ischium layer. It's less flexible. Sorry, the esium layer, not the ischium, the esium layer. So the epimysium envelops the entire muscle. The paramysium envelops individual muscle fibers. The endomysium envelops the paramysium envelops individual muscle bundles, fiber bundles, and then the endomysium envelops these individual muscle fibers. And that's how the structure of the muscle is built. The reason this is important is that you can actually get myofascial impingement of capillaries, veins, nerves, and things like that. And believe it or not, even your skin can stick to these layers and make it hard for the muscle to move properly. An example of this, where you see these connections, is actually cellulite. Cellulite those are dimples of the myofascial network pulling the skin down. At the visceral layer, you have even less flexibility, and it suspends and embeds itself in and around internal organs. So every organ in your body has like a little fascial hammock. That's the visceral layer. Messing around with the visceral layer is not a great idea if you don't know what you're doing. So back to what we were talking about, the lateral lines. These lines run up and down the side of the body. If there's an imbalance in the lateral lines, that's when you start to see things like scoliosis or high hip or low shoulder postures. And this can create a whole series of issues like what you're seeing on the left. It starts in the lateral arch of the foot. It runs up the side of the body, creating lateral stability. Obviously, the IT band is a big part of this. Helps to mediate function in other lines. Particularly the lateral line and the spiral line work together, especially when doing anything that involves gait dynamics. The front and back superficial lines are one of the systems that helps mediate. The arm lines, the spiral line, as I already mentioned. It also assists as a brake on rotational forces. So the lateral line is kind of like, it basically is like an air brake if all of a sudden your body's being twisted in a direction at a high velocity that's not supposed to be. It allows for abduction of the hip and side bending of the trunk. In the cases of high hip or shoulder, it is unilaterally shortened, meaning shortened on one side. So next we're going to look at the spiral line. The spiral line I love to refer to as kind of like the gait flywheel. It's a double helix pattern. It aids in posture by creating a support network that's double helix patterned at supporting the entire body. You can see how it runs from the back of the neck all the way around across the body, down underneath the foot, then back up the back, then back up the spine and attaches to the opposite side of the skull. Often imbalances due to handedness, eye dominance, leg dominance on one side or the other. So like for example, astigmatism contributes to imbalances in the spiral line. Or say you get an ankle injury, something like that, it can contribute to imbalances in the spiral line. I put the guy golfing here because golf is a really great example of a game that requires a high degree of spiral line mechanics. Unfortunately, it's a highly one-sided game. It's vital in gait function and movements. It helps support twisting, lateral movement, and rotation. It makes sure that you stay tightly together while you rotate to create linear force while walking. It interacts with most other lines, including the arm lines, and determines knee tracking. Then we get into the functional lines. You see these get utilized a lot in bodybuilding. As you can see here, there's an anterior, posterior, and lateral functional line. 3 lines are less involved in posture and more involved in day-to-day activity. So when we say day-to-day activity, I'm not talking about sitting and typing. I'm talking about things like labor-based movements. If they affect posture, it's by pulling one shoulder to the opposite hip. So you'll often see these basically like if one side is out of balance from the other, you're going to see it as like a forward rotation of a hip toward the opposite, the forward rotation of a shoulder toward the opposite hip. These lines are highly active during sports function and are always present in gait. These lines pull across the body contralaterally to increase power and accuracy in movements by extending the leverage of the arms across the entire body, meaning that literally your adductors play a role when you throw something because it transfers the energy from your leg through your rectus, through your pectoralis, into your humerus and allows you to throw a ball. Now we get into the arm lines. The arm lines are fascinating. There is actually a superficial and deep anterior and posterior arm line. As you can see here, the deep lines are ones that we would consider most likely tonic structures, and the superficial lines are ones that we would most likely consider phasic structures. The arm lines, just like I said, the arm lines also have these really interesting front and back layers, but as you can see, the arm line goes all the way back to the spine. It goes all the way back to the sternum and spine. Each layer provides support for the full function of the arms and shoulders. You can also see that they're not really linear muscles. They wrap around the bones. Due to repetitive use, these lines can become tightened and they can entrap nerves and affect joint function. Now we're going to get into a really important one, and this is the deep front line. The reason that you see the man there in the fetal position is because the deep front line is mostly the muscles that pull you into the fetal position, at least the deep core muscles that do that. So deep in the body and on the front side of the spine, that's why it's called the deep front line, but what's funny is most of the muscles are hidden behind your organs, but they're on the front anterior side of the spine itself. They stabilize the inner arch of the foot. They provide stability to the legs at each segment. So they kind of generate a kind of postural stability. Again, we would most likely consider the majority of these muscles tonic muscle systems. They support the lumbar from the front of the spine. So the lumbar holds its shape based on regulation between the iliopsoas and the quadratus lumborum, in my opinion. And those guys work together to regulate positioning of the spine. It's also important to note that the TVA plays a role in lumbar flexion. Involved in the shape of the abdominopelvic balloon, including the pelvic floor. If you get into the Anatomy Trains book, they do a really great job of explaining this. If you want to learn more about that, definitely check out that book. It stabilizes the entire body while breathing, because that's important, that you can, breathe and stand or move. It balances the head atop the body. So this is the system. The way I like to describe this system is it's like the string that runs through a basic old school army tent. And the two poles are essentially the skeleton, and then the big sheet that goes over the top is basically all the other fascial layers. So if we want to look at kind of how do these lines relate to system function, we're looking at the deep front line is in, breathing and basic organ function. That's also a really, basic organ function is at the visceral layer, but breathing and like internal posture plays a really big role with the deep front line. So then when we get into like core posture, movement and posture, that's where we get into the anterior, posterior, and lateral lines. For gait function, we definitely see a cross between the lateral side and the spiral. Now I'm not saying that the other lines aren't involved. I'm just saying if you're looking at this in a hierarchy of movement, this is how these lines kind of are built in. Then you get into the functional area. That's where we start combining the arm lines and the functional lines. And when you combine all of it, you get dynamic movement, and then above that, you get compound movement. Now, it's also important to note, we talked about this, that you can get entrapment at different layers. Everything from blood flow to nerve flow. There's a few different ways that the fascial impingement can affect function. At each layer, impingement can occur. So this is all the way up near the skin, all the way down to the intermuscular septa. Like this is like really deep in there. Particularly if you've had some sort of muscular trauma damage or degeneration. If that area has to suddenly heal itself very, very quickly, you can see this happening. If these layers start sticking onto one another, it can cause and affect function due to a decrease in tissue glide. So whenever we're trying to work with fascia or mobilize tissue, we're trying to increase glide. This is really, really important. Nerve impingement can be very painful. Most of the time, people think of nerve impingement as being associated with the spine, but it can happen at the soft tissue level because of improper fascial arrangement. Functional impingements can affect overall function of muscles, tendons, and ligaments. It can create shearing and compression where it doesn't belong. The superficial layers can affect the deep layers if the glide is reduced. So say it starts as a superficial issue, over time it can work its way all the way down. So that's pretty much it for the myofascial meridian or anatomy trains model. But I highly recommend either taking courses or at least buying the book and really getting to know that system, because it's a big piece of what we're going to get into when we start to discuss how this system really operates. And then the next one that we're looking at is something known as the spinal engine model. And the spinal engine model came from a gentleman by the name of Sergei Grekovetsky. He's a Canadian. It incorporates evolutionary biomechanical model. It effectively explains that the spine is not a passive column. So right now, kind of industry-wide in the fitness industry, there's this idea that the core's job is basically to either be static and stable or create anti-rotation, which frankly, the spinal engine model just is the opposite of that. And you'll see why here in a second. It explains the role of the transverse abdominis in with the thoracolumbar fascia in spinal extension, and why the thoracolumbar fascia is one of the most important structures for humans. It is absolutely vital and at the core of our ability to maintain our posture and what makes us different than other apes that are roaming around the planet. Because other apes have stronger, bigger muscle systems than we do, but they can't stand upright. And it's because they don't have the same kind of thoracolumbar fascia that we do. Spinal flexion and rotation can generate a gait cycle even without limbs. You'll see here on the right, we're going to explore this. This gentleman on the right was born without arms or legs and has learned to generate a full gait cycle without limbs. Well, without full limbs. He has some arms. And what's interesting is this is a highly exaggerated version of how we walk, but it's because he lacks the leverage of limbs. If you have the leverage of limbs, you don't need the model doesn't need to be as exaggerated, but you're going to see here that this is a macro version of how human beings need to generate forward force through a series of side bends and rotations. The theory has been used to pioneer non-invasive screening for spinal injury. I am going to leave links for a bunch of this stuff. I'll leave links for almost everything that I'm talking about, but primarily Sergei Grekovetsky has some fantastic videos on YouTube about non-invasive screening for spinal injury and this entire thing. So you don't have to take my word for it. I'm simply going over the basics. You can get it from the horse's mouth from him. I will leave the links in the description. So now we're going to go ahead and take a look at this gentleman walking. What you'll see here is that he is capable of producing forward linear force without limbs by producing a form of side flexion and rotation. And even notice that his torso is moving, but his head stays fairly centered. His neck decouples this from his head. So his eyes stay level and stable, even though he is producing this gait pattern with muscles that attach back to the spine. So you have to understand the spine itself is completely wrapped in a complex series of muscles, and that a number of limb muscles attach back to the spine. So the question is, do the limbs drive spinal movement, or does the spine drive limb movement? And the answer is it's a little bit of both. It can be either, but most effectively it is when the spine is generating a fair amount of force through rotation and lateral flexion. And it's because, and again, you can go watch the videos, it's because at the very beginning of evolution, the very first spine laterally bent. So the very first vertebrates were capable of lateral bending of the spine, which means we are too. Every vertebrate can laterally bend its spine. It's a swimming motion. And since life developed in the ocean, that was the first method of movement. So in humans, what you see beyond that point is not only can we laterally bend, but like quadrupeds, we can anteriorly and posteriorly generate force. That's how, like your dog goes into a sprint, it basically posteriorly flexes in order to gain extension. Its front legs hit the ground and it pulls itself on the anterior side, pulling its back legs up between its front legs. Well, its front legs go between its back legs, and then it snaps off the back legs, going back into posterior extension again. And it does this as a bending motion. Now, you take that, which we can do very, very well, and you add the fact that we can do it unilaterally or contralaterally, and you also apply the fact that we are capable of rotation. So humans can side bend, we can flex anteriorly and posteriorly, and we can rotate. Now, quadrupeds do this too, just not nearly as effectively as we do. So if you have pets or you're around pets at some point, watch how they walk when they're not running. What you'll notice is a kind of snake-like swimming motion. And that is the motion that all vertebrates should be generating when they're doing basic gait. And there's a really huge health benefit for this, and it's because it actually helps to decompress and hydrate the tissues in and around the spine. And if you've ever had a prolapsed disc, or you've had a degenerating disc, or even a spinal fracture, you know how absolutely vital it is that you're getting fluid, blood flow and synovial fluid in and around the spine in order to feed that tissue. So again, this is a basic overview of these fields. I'm going to leave a bunch of information in the description. Please continue on and do more research. My goal with this program and this course is to create a roadmap for you to get all the knowledge that you could possibly need to train in a completely different way and understand human movement in a completely different way, because the truth of the matter is the modern paradigm, it's lacking something. And we're going to talk about that in the next video. And we're going to talk about how to treat that and how to let's move on to the next step, where our goal is looking at lifelong health and wellness and fitness, and how we can achieve that by utilizing these lenses, these principles, and understanding how we got to where we are and what we can do to move forward in a much, much more effective way. So thank you for watching. Thank you for listening. And I will see you guys in the next video.